first flight of the orbiter Discovery, and the shuttle has cleared the tower.
Well, hey, guys. Welcome to a new episode of Health or High Water. I'm Trip Parks, your host today. Hopefully, we'll have Brett come in soon. He's training someone. I don't know if you hear the background. He's kicking his butt right now. I've got the amazing Dr. Randy Snook here with me today. Can't wait to dive into his past. We have a product that we've both been using, HOHW Boost, that we're obsessed with, and can't wait to dive into that. Make sure you guys are liking, subscribing, and following. Yell it out of your car, tweet about us. Anything you guys got to do, get magnet stickers for your car. That might be a good idea, but any little bit you guys do helped. Thank you to all the new listeners and the listeners that have been with us for so long. Thank you guys so much. Every little bit of what you guys do helps us keep this podcast going and growing. So Dr. Randy Snook, man.
Hey, Trip.
I'm so excited. Shoot. We have some technical difficulties here. My microphone stand just fell apart. I met you about a month ago this week, and we've both been using a product, HOHW Boost, and you're their physician, right?
That's correct. I'm what they call their medical advisor for this company. The company's name is HOHW, and the offshoot came off as HOHW Boost, which is this new product that we've been promoting called the HOHW Boost. It's a powdered oxygen product.
Well, I've tried it, and it works. I absolutely love it, man.
Yeah. So it's kind of interesting, and I'll kind of tell the story on how I got involved because it's pretty interesting.
Yeah.
And I'll go back with just a little bit of the history of how this product was developed and where it came from. And back in about 2011, there were some military people that got together that wanted to create something that they could use in the field during an injury during wartime or any kind of injury in battle, so to speak. And what they found was there's this what's called the golden hour that occurs when somebody's injured, that if there's a respiratory compromise, you have to get something done during that time period or you'll lose the soldier and ultimately death. And what they found was they came up with a product, and this is very interesting, that they could somehow encapsulate oxygen in a powder. And when they developed this, they thought, well, this could be a phenomenal product during that time period. Long story short, as that evolved, it went to studies, and they started studying it in animals and whatnot. There were 3 generals at the time that wanted to try to take this forward, and they developed this company called HOHW. And HOHW had an offshoot come off of this called HOHW Boost, and this is the product that is now available with this powdered oxygen. It's a very unique system in that they figured out how to enclose what they call diatomic oxygen in what's an aluminum hydroxide clathrate. Clathrate just means it's something that surrounds the oxygen.
Right.
And the unique thing about this, and why I've gotten into using this, is that it will deliver to the body through the digestive tract as one source. There's multiple other ways this can be taken into the body, but through the digestive tract, you can actually absorb 66% oxygen from this particular product. And so as you take a capsule, within about 20 minutes, it raises your oxygen level.
Well, I can't wait to dive in a little more with the science on that, but I've used the product, and it's like I can't stop working out.
Right.
I can just keep going and going. I stopped taking pre-workout altogether. It's the same kind of function, right? You're just trying to...
Absolutely. And you use it in addition to your pre-workout. This is something that will just raise the level of your oxygen in your bloodstream. And as this kind of product started getting researched over the next about 10, 12 years until 2022, they did studies on it, and they found some very interesting things that this oxygen delivered to the body and actually had as an effect on the body. And a study that was done, I think it's been about 4 or 5 years ago, showed several things happen when you consume this HOHW Boost. First thing is it raises what's called your PO2, which is your partial pressure of oxygen. And when they studied it, actually had a significant increase in the patient's oxygen right off the bat. And that would happen within the first 20 minutes. Second thing, which there's a couple other things, or second and third thing, which are very interesting to me, is as they were analyzing this, they noticed that it raised something called ATP. And if you know a little bit of science, ATP is the energy building blocks that we have that are produced to feed our muscles so that we have contraction and metabolism and everything else. And they actually saw that this was raised by the HOHW Boost. Third thing that happened, and I find this incredibly interesting when you look at some of the other applications, is it also decreased something called C-reactive protein. And CRP is a non-specific inflammatory marker.
Right.
So this is like an anti-inflammatory as well with this particular medication or medication supplement.
Well, this just sounds amazing, man. Well,
Yeah.
I want to get into you though. I want to
bet.
talk a little about you, your past. Like,
Sure.
how'd you get in this position to begin with? You know, what's your backstory? Where'd you go to school? Give me the nitty gritty, man.
All right, you betcha. So I grew up in Colorado, actually southern Colorado, a little small town called Alamosa in the San Luis Valley, surrounded by mountains. The base of the valley is 7,400 feet above sea level. And so I was a mountain boy. I was up in the mountains all the time. I had gone to CSU, and after CSU, went down to college, medical school in Texas. I was part of the University of Texas Health Science System in San Antonio. When I finished that, I went on to residency at University of Missouri, finished the residency at University of New Mexico, and did a fellowship training in geriatrics. At the end of it all, I moved here in 1995, and I've been a practicing internal medicine doctor since then. Where I came across this is very interesting. It's kind of a fun story.
Yeah.
I have a patient who, one of those three generals I mentioned earlier, is her father, since retired, older gentleman. And we had gone to a function together, and her father was there. And we started talking. He knew I was an internist and a doctor for many, many years, 33 years. And he says, Randy, he says, sir, I've got to introduce you to this product. And he says, it's powdered oxygen. And I looked at him. I was like, yeah, right. You know, there's no such thing. And he said, no. And he hands me this golf ball box. So it's an empty golf ball box full of this white powder. So you might imagine what I'm thinking, oh, geez.
Oh, no.
And it's this really fine white powder. He said, this is OX66, which is powdered oxygen. And he said, I'm going to go back and talk to the guys that are part of this whole company. I want to get you involved. They need some medical advice, some medical help getting this thing going forward. About 2 years went by, COVID hit, several things kind of took over. I'd never got involved yet. And then when COVID was going on, about the second year of COVID, his daughter became ill from a COVID virus. And she ended up having to go into the hospital, developed pneumonia, started requiring oxygen while she was in the hospital. And so she was discharged home on oxygen, supplemental oxygen. And she got home, and of course, as this company is part of her family, she started taking O2 Boost. And she was taking 2 capsules about every 3 to 4 hours. Got off oxygen within a couple of days.
Wow.
Yeah. And so her next step was to come to me as a post-hospitalization to see how she was doing. And that's when we kind of started talking about it again. And she said, I'm going to call the general. We got to get you involved. And so from there, I started researching the company. I got to know some of the people that were at the higher-ups, and the relationship started as me being the medical advisor for them.
That's a crazy, interesting story, man.
It is.
That's crazy. It's crazy how it helped her out too. So, you take it, right?
Yes.
You take it?
Absolutely, daily before I work out.
Okay.
I'm a huge proponent of exercise. When I do physicals on patients, that's the first thing we talk about is what's your exercise, how are you taking care of your health, what's your diet. And I've found that this product really does help you perform at a better level when you exercise. And it's good even if you have something that you've done where you're kind of exhausted at the end of it. It'll really help in the post-exercise recovery as well. So it's good for that.
It just sounds like it's good for everything, man.
Well, it is. We'll think about it. Oxygen helps everything, and oxygen is required by almost anything. And when we look at what this product does, delivering oxygen, you can't imagine that it wouldn't have a bad impact.
Well, no, and the cool thing is, so I used to have a company called the Protein Bar back in the day, and I was trying to sell the genetics, and wasn't happening back then.
Sure.
But I had an oxygen bar in the back. So
Okay.
I was kind of interested in, the low amounts of oxygen we have in the atmosphere and all the other
Let's talk about
factors.
that. That's
there's
exactly right.
Right?
So our oxygen content and our air that we breathe, like you and I are breathing right now.
Especially in Denver.
Yes.
For those who don't know, we're in Denver.
It's probably in Denver 20%, but in most places it's 20 to 21%
Right.
of the total molecules that are in the air. 21% is oxygen. When I have somebody, as they would come into an emergency room or was in the ICU and they had a low oxygen, we would deliver oxygen by what's called a nasal cannula. So your oxygen bar did that.
Right.
unfortunately, with delivering that, you can never deliver 100% oxygen. Don't let anybody tell you that they do that. It's actually the only way you can deliver oxygen by nasal cannula or a mask that covers your whole face. It'll only amount to at maximum probably 40%. Okay, so you can raise it up, though. You can get your oxygen level up by doing that, but the maximum you can deliver.
It's 40%.
Exactly. Inside this cloth rate of this O2 boost is 66% oxygen. So they were able to capture the amount of oxygen, diatomic oxygen, which is O2, of 66%. So this is actually delivering a higher percentage than you can get by a nasal cannula or anything else.
Well, so on that, hyperbaric chambers, or what? Am I saying it right?
Yes.
So they're using oxygen to deliver the same thing, but they just have to sit in there for like an hour, right?
Correct. And in that situation, it's the pressure that's also changing that helps infuse that. But you can't get past anywhere from 40% to really deliver oxygen to the tissues inside the lungs, everything else.
So this sounds like even a time saver for everybody.
Absolutely.
Right?
Well, and that's what the original military use wanted to be, was they're like, you're out in the field. How are you going to carry oxygen tanks? How are you going to deliver something at a really high enough level to help save that soldier? Here was a product that's powdered that you can carry very easily and deliver and actually help to treat the injured victim. And so you can imagine going way past that in just the normal person. If they need extra oxygen, here's a way that you can actually deliver it very safely and very easily.
I mean, you're talking about 2/3 increase from just your what you're saying, a normal atmospheric
What you're
level.
breathing, absolutely,
right?
Absolutely.
And the air quality is even worse than it has been before. So we're not getting the right
absolutely.
stuff.
During pollution days, this is the perfect solution for somebody to actually increase their PO2 or their oxygen content in their bloodstream.
That's interesting. Now, this might be off a little bit here asking, but like, is the polluted air we're breathing reducing our absorption rates for our lungs too?
Well, of course, over the time, it's almost like smoking.
Right.
The particulate matter that we breathe in is filtered, but it does not get released. Once it goes through the filters of our lungs, it's trapped. And so, over the course of time, you're going to trap lots of particulate that's in the lung. And a way to maybe bypass that, let's say, is to have supplemental oxygen in a capsule form so that you don't have to suffer the side effects of having all that particulate.
That's interesting. I was just thinking about that because I was like, it's just like we're all just secondhand smoking all the time.
Absolutely. Now, and especially in crowded cities and exhaust and everything else that we're exposed to on a day-to-day basis.
100%. So like even those little O2 cans then, because I used to sell those cans, and they're shit, right?
Well, it's the same principle that we just talked about. You can only deliver so much oxygen from a can. That'll get, I think that one probably delivers about 28% oxygen. 28. And that's the maximum. And it's short-lived. It's compressed air. It's hard to carry. It's how do you dispose of the container? There's lots of things that we don't really necessarily think about when carrying those things. Here you have something that weighs nothing that you could carry in your pocket that will deliver the oxygen
more effectively and with a higher percentage.
Absolutely.
It's crazy, man.
It is crazy.
So what's the science behind this? How is it like digested? How does it work? How does it get to where it needs to be?
So again, what they discovered that they could do, and it's a patented process. I don't know the exact thing. They won't tell anybody because this is an absolutely unique product. There's nothing like it in the world. And what they figured out they could do is they could take this aluminum hydroxide and encapsulate it. What you have to think about is almost like a ball around the oxygen molecules that is dissolvable. And so when aluminum hydroxide is basically an antacid, we take it as Tums and other things, and it really just is something that you can take to decrease the acid production in your stomach and settle your stomach. Well, they figured out how they could surround that diatomic oxygen. So there's literally O2 inside this little product. Once it gets into the stomach, the clathrate is dissolved by your stomach acids, and it's absorbed into the stomach. And so that goes directly into your bloodstream. So this literally bypasses having to go through the lungs. You go straight into the bloodstream. I had a question one time by a doctor, well, what about the first pass effect when it goes through the liver? Does that change anything? No, this is oxygen. It's not going to change it because it isn't a toxin. It's nothing that's going to get filtered out in the liver. This is still just in your bloodstream, raising your oxygen level.
Man, that's crazy. The science like this is out there for us to be able to do this. And again, for someone who had an oxygen bar,
Oh, yeah.
seeing this product, it blew my mind as soon as, we started getting connected with each other.
Absolutely.
So I know COVID kind of stopped up the barrel of things. So what's the next phase for you guys for this product?
Absolutely. Well, as you might imagine, there's just a tremendous number of applications, both orally and topically.
Oh, yeah.
And I'll talk about at the end, we're working on something where you can actually put it in an IV and deliver oxygen through an IV. Exactly. So our first thought was, let's go after the respiratory side of things. And what I'm recommending is multiple ways of using this. And you bring up COVID because COVID is a real thing, and it's like any viral illness.
Well, it's coming back too, right?
Yes, it is. It's starting a new wave. Just like the flu season, though. Right. All these things are coming back. And this time of year, as people are indoors more, the kids go to school, you see passing of the viruses more and more. And so we're going to see a lot more respiratory illnesses. What we're thinking is, and this is, I think, an absolutely perfect place, is that when somebody contracts COVID or any other virus, including influenza, I still see just as many cases of influenza, which affects the respiratory tract. You can start with taking these capsules right off the bat, and you're going to maintain your oxygen level so that the rest of your body can heal and fight off the virus. There's certainly some medications out there, but this is kind of an adjunct to the treatment of COVID where you can maintain a good oxygen level right from the get-go. We have somebody that works with us. His father is 94, I think, years old, and last year contracted COVID. He got very ill. He was at home. He didn't want to go to the hospital. His son had a pulse oximeter. We buy those all the time. They're the little device you put on your finger, and it measured oxygen through your fingernail. And his dad's oxygen dropped down to 86. And his son kept telling him, I want you to do something about this. Let's have you take some of this O2 boost, because if it gets lower, you're going to have to go to the hospital. And of course, his dad didn't want to go to the hospital at 94. Well, sure enough, he started taking O2 boost. His oxygen shot up to 90, and it stayed above 90, and he avoided the hospital.
That's amazing.
So I'm promoting it in a sense that if you contract COVID, you test positive, this is a great place to prevent the respiratory side from progressing, or at least not progressing to the point where you'd have to go get attention.
Right, and you're helping your body fight it off because it's fueled properly.
Absolutely. Oxygen is good for anything, and certainly in fighting off viruses and bacteria and things along that lines.
All right, so I'm going to ask a little bit of a dumb question real quick.
No problem. No dumb questions here.
This is going to be a little dumb, but plants, bugs, dinosaurs, they all grew bigger because they had more oxygen in their environment. They're enormous. Mm-hmm. So would there be any application for helping a kid grow, giving it to a kid? Is there any correlation there?
It's certainly a possibility. I can't answer that because we haven't studied that side of it for certainly growth and growth hormone and the effects it might have on that. So I can't say yes or no on that, but it makes sense that the more oxygen you supply to something that's trying to generate ATP, let's say, for that matter, and the anti-inflammatory side of it, it absolutely possibly could do that.
I want there to be a correlation there because when I have kids, I want to give this to my kid. I just want to have an ox as a son.
There you go.
Well, I want to get a little bit more into the sports application
Sure.
of what this can do for things. And I mean, we're already in Denver. We're high up. The oxygen is a little bit lower than everywhere else. Mm-hmm. What could application of this be like the Broncos?
Right.
Like everyone that comes here suffers from oxygen deprivation.
Absolutely. Well, it's a known fact in medicine, especially in any kind of science related to altitude. For about every 5,000 foot change, it's significant enough change in the oxygen content that you're going to have to adapt to that particular situation. And how we adapt is usually if somebody's going to say, let's say, move to Denver and they came from sea level, it's going to probably take about 3 to 4 months for them to adapt. And why that is our oxygen-carrying red blood cells have a certain compound on them that has to be adjusted to release oxygen. And so as we're here, the new red blood cells that come out of your bone marrow, which those red blood cells live about 120 days, have to be replaced by this new red blood cell that has this different concentration of GDP6 is what it's called. And that helps release oxygen when it's out in the tissues. So you might imagine we don't want to wait 3 or 4 months before we can adapt to what the oxygen level is in Colorado.
Right.
This is a method of replacing that, because you're going to be giving on a daily basis extra oxygen for those red blood cells to carry so they can deliver it to the tissues. So in an altitude situation of anything that's over 5,000 foot change, you'll see benefits from this thing to prevent altitude sickness, to prevent shortness of breath when you're walking or hiking and that kind of thing. And that's where we're looking as an application to prevent altitude sickness when people come from lower elevations, or even here in Denver, where if you're going to climb a 14,000 foot peak, obviously you're going to make a huge change in your altitude. We're seeing a lot of benefit from that.
Well, I mean, a lot of people are flying out here from sea level to hike and do those things, and you're talking about literally a 14,000 foot elevation change in a few days.
Absolutely. And that's why a lot of people don't tolerate it. They get the true altitude sickness, which is headaches and nausea and severe fatigue and dizziness. All those things are part of the constellation of symptoms of altitude sickness, and we're seeing that this can actually prevent that. We have a testimonial from a gentleman and his daughter who climbed Kilimanjaro, and I believe he was from California, so he is at a lower altitude to begin with, and they went to Kilimanjaro. They had our product with them, and he has attested to this, that as they were climbing, they had a big group of people. Him and his daughter were taking the O2 boost throughout the entire climb, about every 2 to 3 hours. They did not require oxygen by the time they summited Kilimanjaro. And they have signs of them on top of it without oxygen. There were a lot of other people that went on the climb with them that had oxygen, and they did not need it the entire time using O2 boost.
So they're carrying oxygen with them?
Yes.
Oh my goodness.
Yeah, a lot of them have to. You see these pictures of when they're climbing Everest, and there's tanks left behind all over the place, because you have to carry oxygen if you're changing a big elevation like that, to maintain your mentation and your energy level to climb. And so those big elevation changes, I think Kilimanjaro is over 19,000 feet. A lot of patients or a lot of people that are climbing that were going to have to use supplemental oxygen. Well, this guy with his daughter did not have to because of taking O2 boost.
Well, that's crazy. I mean, I guess the sports applications are really endless too, with the ATP and energy.
Absolutely.
So how does it affect how does oxygen affect your energy then?
Well, of course it raises it, because
Right.
oxygen is part of the metabolic process of respiration in the muscles and the use of our energy, our ATP units. We found that it increases that, but you need oxygen to do this cycle called the Krebs cycle to produce ATP and have energy for your muscles to contract and movement. And so it's absolutely necessary to have oxygen. That's why we're not anaerobic, which is something that can exist without oxygen.
Well, dang, man, you're just taking me to school a little bit. And I think everybody listening in their car, at the gym, is learning something.
Or they're tired of hearing about it.
No, I doubt it, man. This is some interesting stuff.
It is.
I'll tell a funny story. So about 5 years ago, I visited Denver with my girlfriend at the time. And we both smoked a little bit of weed while we were here. Mm-hmm. She had half a beer, and then she got super sick.
Yeah.
So she blamed it on the weed.
Right.
And then we got in the car the next day to go take an Uber to downtown, and then we told the story to the Uber driver. He's like, no, you had altitude sickness.
That's exactly right.
Right.
That was a big change, and obviously then when you combine in, maybe a little bit of particulate from smoking, but the alcohol, which depresses your respiratory tract.
Right.
You're not going to have enough oxygen traveling. If she'd have had that, it might have made a huge difference.
Well, man, so travel applications, sports applications. So I'm thinking about, not viruses. Let's talk about, people that need like CPAP machines. Like what kind of applications there?
We don't know yet.
Okay.
I think that those are the boundaries we have not gone past yet, and we're researching it on a constant basis. And like I said, one of the applications we've just started our particular study going forward in is IV application. So my company and the scientists involved with it have figured out a way to put it into a liquid so it can be infused in through the vein. And we haven't studied it enough yet to definitely recommend it in the human population, but we're about to start some of those big studies now. Another spot that's, I think, going to be huge is topical. And let's talk about that.
Yeah.
So we have a spray that actually contains this OX66 in the spray. And when you atomize it and spray it over the skin, as it absorbs into the skin, it releases that same oxygen on the surface of the skin. And oxygen on skin is always good. We're seeing now some really good applications for several things. And in my office, I'm treating actually acne with this spray. And we're seeing just huge results. And I think part of that is a little bit about the anti-inflammatory side of where it decreases that CRP level I talked about a little bit earlier. And that's an inflammation. And certainly acne is an inflamed comedone, which is the little sweat gland that's next to your hair. And what we're seeing is that you can use this application, deliver that oxygen, and it treats the acne extremely well. It'll clear acne like you can't believe.
I wish I would have had that when I was a teenager.
Exactly. Now, we have actually somebody out of California, and I'll mention her name is Arlisa. She's a influencer that she had met one of the guys in our company who is one of our marketing people, and she started trying the spray, and she's now going to represent O2 Boost for this because she's seen such an incredible result with her acne. I've had patients in my office, I've had my staff in my office that have tried it, and they're seeing huge results with acne.
Well, I just going through my brain real quick, thinking about the applications here too. It's like, well, what if you added a sunscreen too, right?
Absolutely.
Would that help out with sunscreen, help with protection? Because I feel like the oxygen helping with the melanin in the skin protects it.
No, you're absolutely right. As a matter of fact, also in treatment of sunburn. Okay.
Oh, okay.
Because I have a good friend lives in my neighborhood, and his son just played in the USAM here in Denver area, and out at Colorado Golf Club they have no trees. And my friend, he's in his 70s, walked the entire course the entire time while his son was playing. And he used sunblock, but he still had way too much sun exposure. And he already had some sun damage on his arms. And he came up to me the day after he had been out on the golf course with his son, and he showed it to me. And I said, well, you got to try this spray. He used the spray, and I'm going to have before and after pictures we're going to put on our website. It literally treated that, brought the oxygen into that skin, and reduced the burn that he had and the severity of his skin lesions within just 2 days. So and it makes sense. If you deliver oxygen, it's healing. It's going to heal that skin that's already irritated, the anti-inflammatory, again, capability that I mentioned. That's all going to be a big process. It's going to help the skin.
Well, geez, I guess we can work with scar tissue too then.
Absolutely.
Really.
In psoriasis, we've got case after case of testimonials where we've used the topical on psoriasis, and it actually heals the psoriasis, again, because oxygen is really good for healing. We're seeing that. And I think what's going to be very much coming forward, and this is where our Lisa, the influencer, is going to be part of it, and we have a couple of skin companies that are interested in it, is now everybody's into the anti-aging. And we're starting to see where oxygen therapy is incredible for anti-aging. And so much so that if you look up on the internet, there are these new oxygen facials that are being promoted at the high-end dermatology and salon places. And they're basically just delivering oxygen, again, by a mask or some kind of hood that's over the face. We're going to do it topically. It's going to be applied by a cream. It delivers the oxygen directly. It's 66% delivered, and it's going to have a huge impact on the anti-aging side of treatment as well.
Well, longevity is the next big thing, like preventative health and whatnot. And I was just thinking, too, it's like, well, of course, people back in the day, like even 20,000 years ago, you know what I mean? Like there was more oxygen in the air. Their skin was better, and we're reducing that, and we're seeing more skin issues. We're seeing more just more respiratory issues, and our environment and atmosphere is affecting all of that.
Absolutely. Maybe there'll be a time where you go to like not that you want to tan because that's not healthy for your skin,
right?
But you go in and then you stand naked and then all this spray just comes on you that's full of O2 Boost and oxygen, just adding it to your skin to make you younger every day.
Well, I think that's awesome too. And again, like it's helping with skin protectant too. Like everyone gave me so much shit for not using sunblock when I was younger, and I was like, I guarantee one day you'll figure out that gives you cancer.
Absolutely.
Right? And then now we're seeing, Coppertone and a bunch of other companies are coming under suit for carcinogen products in their
absolutely
cream.
And this is absolutely non-toxic, and so I'll say that too as well. We did some huge toxicity studies in the past 10 years, and we went to 2,000% the dose that we use at a maximum dose in a human, in rats, in all these different studies, and no adverse effects whatsoever. So it's absolutely non-toxic and non-threatening, and of course it would be, because it's just oxygen and aluminum hydroxide, which has nothing to do with anything else. So
Oh man, I'm gonna do. I'll be the first study for when we have kids. We'll see if they turn them into giants.
There you go.
see if it helps with that stuff too.
Yeah.
But yeah, man, it's really interesting stuff. Like I just keep on thinking about the atmosphere and how we're literally stuck in it all the time, and how it's really having an adverse effect on us right now.
And we got to figure out ways to get more oxygen. Well,
Right.
we've found one here, and it's an incredibly clean product that if we can get it from internal or external, I don't see how this is not going to be something that's going to be so beneficial to people to use on a daily basis.
So I know you use this in your clinic quite a bit with certain things. Do you have any you don't have to use names or anything, but any stories maybe to share with us about the product?
Absolutely. Well, of course, the first one was the daughter of the general.
Right.
So when she had COVID, she was able to get off oxygen quicker. And that's a big thing. I think in respiratory illnesses, it's a huge thing. And I'm recommending we have these little 6-packs that they can buy where you take 2 capsules right away when you get an upper respiratory infection of any sort, and it'll help thwart that problem with the respiratory tract. I have a patient that's a great story. She has lived in Denver for an incredibly long period of time. She retired and moved to Steamboat, and Steamboat Springs in Colorado is at a high altitude. And so she has probably at least a 5,000 foot change every time she goes back and forth, and she still has business down here. And she comes to see me still as her doctor. And I've been treating neck stuff with acupuncture and some other things like that. Well, this one day she came in and I said, how is Steamboat? She said, I don't know what to do. She said, every time I drive up there, I get a migraine headache. And she does have a history of migraines. And I said to her, well, let's try something. Let's have you try 1 or even 2 of these capsules the day that you're driving back up to Steamboat. And when you get to altitude, let's see if it'll actually prevent your headaches. And it has completely prevented it. So there shows another possibility. And when we treat migraines in our offices, we have lots of chemicals and prescriptions and things that we're able to do that with as well. When we get a refractory patient like in the ER where we just can't get their headache to go away, in some of those patients, we deliver supplemental oxygen. We'll put them on a nasal cannula, give them a higher dose of oxygen, gets up to 30, 40%, and it makes their headaches go away sometimes. That's why I think this worked so well with her for change of altitude migraine headaches. So migraines are going to be a big place where it can be used as well.
Well, that's I know a lot of people suffer with that. So if help them out even a little bit. I want to talk a little bit about the immune system and how this works.
Sure.
Obviously, we need oxygen as a nutrient. Are you seeing any of your patients? What's the word? Have a better immune system while taking this?
It's a great question, and I can't say I directly see that, but I can't imagine that if somebody doesn't have a better oxygen and is able to exercise more, that they're not going to get healthier just simply because of their physical activity level and maybe weight loss because of that. It doesn't cause weight loss, but because of all their ability to maintain good exercise and good health in that respect, absolutely that's going to help the immune system. We haven't studied it per se to see if it does have an impact, but I think it would be just reasonable to assume that probably is going to improve with better exercise.
That's what I was thinking. I was like, if you're properly fueling your body with the amount of oxygen you need, you're exercising, whatnot, your body's more prepared for a cold or a virus, and you're probably not going to get as sick much.
Absolutely. And the anti-inflammatory effect, once again, that we talk about, that's also part of how diseases and how things affect us is the amount of inflammation they cause in the body.
Right. Well, dang, this is crazy. So I know we're getting kind of towards the end here with things. I want to give you some time to, promote your website, promote anything O2 you want to do. Just this is your time to kind of go off and share the world what you're doing.
Absolutely. So we do have a website. It's o2boost.com, and you can see on it that we have several products currently. There's going to be more that are going to be added to it. Right now we have the capsule form, of which you can buy a bottle of these capsules and try it out and see if in these particular situations that we've talked about, if you get results with it. We also have the dermatologic spray that's on there, O2 Boost spray. And what will be coming soon is an O2 Boost cream, as well as we're going to have a serum. Those are the big things that are hot right now in dermatology is face serums and things like that. And our scientists and our people that are running the business have put together a serum that's going to have hyaluronic acid in it and some chitosan and all these different compounds that are very healthy for the skin. That should be coming fairly soon now too as well. Which will also get on there, and you'll see is the scientific evidence. We boast the things we've done so far because they're so remarkable with how it evolved and where the science came from, and you'll see the toxicity studies. We did a study with athletes not too long ago at one of the universities in Utah, and we saw in women especially an increase in their VO2 max with taking O2 Boost. And I think that lends itself to, the value you're going to see as far as pre and post workout, that it's going to be very valuable for that. But when you go to our website, you can find all those things related to that. We have testimonials one after another about the success that we've seen with it. And as our ongoing research continues, we're going to, of course, put that on the website as well.
And you own integrative medicine, right? Here in
Yeah, my
Denver?
practice is called Advanced Integrative Medicine, and we're down in South Denver. There's a suburb down there called Lone Tree, and I've been down there 16 years, and I guess that's probably why I fit with this company. Was my practice is integrated, so we have some of the complementary medicines in our practice as well.
Right.
I practice pain management, acupuncture, which I learned almost 15, 16 years ago, and it's been remarkable how much pain management I get with that. We also have naturopath in our office. We have osteopathic doctors. They do manipulation and things along that lines. We have a psychologist. We have a nutritionist. So we kind of have the whole ball of wax, and we do everything in there. We have a physician assistant who does women's hormones. So we're really into the bioidentical hormones as well. So
Just talking my lingo, man.
Yep.
Talking my lingo. So I'll put all of your stuff in the bio too. If you
Okay.
if any of you visit listeners really want to go check this out, I highly recommend it. I'll put everything in the bio, links to your website as well as O2 Boost. I'll also put some social media for them up as well on the bio. So make sure you guys are going to go check this out. Get on board now before the train leaves.
Yep.
Get on board now. We've been using this product for about a month now. Love it.
Yeah.
And I worked in supplementation for 8 years. Yeah. So like for me to fall in love with the supplement, it's a hard sell for me.
Oh, yeah. Well, and this is a one of a kind. There's nothing like it out there. And like I said, the first time I heard about powdered oxygen, I thought to myself, there's no way. Well, they figured it out. Somebody figured it out, and it's going to be an incredible way to deliver oxygen in so many different ways going forward.
Well, I see just all the applications in sports, medicine in general, and just general comfortability of life. Right. So thank you so much for coming on.
Thank you, Trip.
No worries. Well, I want to have you back on and talk about just you sometime, man, and just talk about your practice and get to know you a little better. Make sure you guys again like, subscribe, and share. Pretty please. But also make sure you guys are checking my book out on Amazon and Kindle. Hard books on Amazon, Kindle. It's on ebook. Make sure you guys are checking out Kaliva Labs, our supplement brand. It's on ascendperformancetraining.com, and on that same site, you can check out Brett's blog. Might as well go and check the blog out while you're checking the supplements out. As well, we got some new programs coming out that we can't wait to release you guys. I gave Dr. Snook a little sneak peek during the grand opening. It's 26 pages now, so it's even more.
Looks wonderful.
I'm excited to help people out doing what we're doing. So make sure you guys are staying tuned for that. And thank you guys for coming in. Thank you, Dr. Snook.
Thank you, Trip.